I'm Carmen, and I am your myofunctional educator extraordinaire. I kind of like how that sounds. Anyhow, I'm an online myofunctional therapist, and I have a practice globally, so I see people all over, and I do a fair share of educating too. That's an important part of my job. So today, in this Myo Minute, we are going to talk about whether a frenectomy can help your symptoms. This is something that I get asked a lot, and my response really is that if your symptoms are related to the myofunctional impairment, then a frenectomy will probably help. So a couple great examples that I like to give my clients when we're talking about this is headache. So first let's talk about headache. So when I have clients who are doing their comprehensive myofunctional exam and they tell me that they suffer from headaches, it is my job to dig a little bit deeper to see, is that a tension headache? Is that a migraine? I would never want to tell my client that a frenectomy would help a migraine. Migraines are very, very common, but they are very intricate problems, and they can be caused by a number of different things. Hormones, foods, smells, structural misalignment are just a few of the things that can trigger a migraine. So it may or may not have anything to do with a tongue tie. Now, if you take a tension headache, that is a whole nother ball of wax. That is something that is pretty commonly solved when somebody has a frenectomy. A lot of my clients have upper body pain and tension, and many of them just say, oh, I've just never felt really great or comfortable in my upper body. These clients, I would probably feel pretty comfortable to say, you know what, you're probably going to get some pretty good results if you have a frenectomy done. Now, one thing that I am very, very, very careful about is I never want to sound like a creepy used car salesman, or I never want to sound like a snake oil salesman. So when I talk about a frenectomy helping improve symptoms, of course, we're talking about that in general. You know, I don't make promises. Everybody is a little bit different. And some of it relates to actually doing the myofunctional therapy. So I can teach you all day long, but if you're not doing anything, then your results are not going to be great. Another great example of symptoms is digestive issues. So there are a ton of different things that can cause digestive issues. Medications have a side effect of a digestive issue, how you swallow, rapid eating behaviors, lots of different things. When I have a client who has tons of digestive issues, and they also have swallowing impairment, so they might have a tongue thrust swallowing pattern. If they have a tongue tie, they probably have some digestive issues related to how they chew their food, if they chew it long enough, how they swallow, those type of things. So we will generally see some improvement there. Again, no promises made, but it's my goal to help you understand symptoms and what the goal of myofunctional therapy and a frenectomy would be. Now, as an experienced myofunctional therapist, I can tell you this is an important part of our job. So when I am going through a comprehensive exam with a client, I tell them right at the beginning that my goal when I am done is that you have no questions, because I've done my job. I've done my job to answer your questions and help you connect your symptoms to what could be causing it. Okay? So why should you care, right? Over time, compensation will go by the wayside and you'll start to see an increase in symptoms. Unfortunately, this might be 5 years from now, could be 10 years from now. It just depends. A lot of older clients are starting to have some of these issues. If you think that wellness for yourself is important, then I encourage you to deal with these issues sooner rather than later. Myofunctional impairment such as snoring, mouth breathing, incorrect mouth posture, these can all prevent you from being the healthiest version of yourself. So if wellness matters to you, then I think you should care, and I think you should want to evaluate having a frenectomy done and understanding your symptoms. So you would do this by finding yourself somebody to work with. Now, I always say find yourself a myofunctional educator extraordinaire like me. It doesn't have to be me, but it needs to be somebody. But in my Facebook Live today, I am going to be talking about some of the most common symptoms that I see. And we're going to talk about those that seem to get relief from a frenectomy. So if that interests you, you can certainly catch me live today on my Facebook page. That is at The Tongue Trainer. I'm going to be live at 11:30 this morning. That's Mountain Standard Time. But I also don't want you to forget to get your freebie. So it should be in your email. This freebie is going to be so important to you. It is a great tool. It is my myofunctional assessment tool for adults and children. Take the time to go through it. Ask yourself these questions. See if you have myofunctional impairment, and then it's going to give you something to go off of. With that said, I am here for you, and I will see you in the next Myo Minute.